So there are two things I think that make it very unique, and the first is the fact that the modeling was done on the whole health ecosystem, not just on one part, not just on a doctor or a hospital or a caregiver or a provider, but the whole ecosystem, including the patients' caregivers, doctors, administrators, payers, etc. So what we're really looking at is what makes a whole ecosystem effective and what can people do from their part of that ecosystem. And I don't think any other research has actually ever looked at that, and that realization that it's the ecosystem itself that makes each part also more effective. So the second thing that is really unique about this research is the emphasis on what we would call mindset, that success factor modeling is looking at the relationship between three things. Number one is the outcomes. What makes a successful healthcare system? What are the goals? What are the results that are produced? Secondly, what are the actions that are necessary to get those results? And third, and maybe the most importantly, is what are the qualities and elements of mindset that are necessary to produce those actions within that ecosystem. So big focus of this research was what are the shifts, what are the improvements, the upgrades of mindset that are necessary to take the performance of the whole ecosystem to a next level. Well, one of the things, by the way, that came out of this approach in response to that question is the whole notion is that the patient should be at the center of all the activity of the healthcare ecosystem. And I think when that is clear, every patient is going to benefit. So patients will benefit in multiple ways, not only in terms of direct care that they may receive from doctors or nurses, but also in the way that the whole ecosystem is working to support them. And one of the things that was coming out of this program is it's not only a benefit to the patient, but it's to their families, to the children of the patients, etc. So patients will benefit in not only increased, let's say, technical support of whatever healing process they need, but also this idea of emotional support, of the bringing of support of, let's say, all the different aspects of the patient, supporting the patient's mindset as well as their physical needs. So what we've been doing here and where we're ending this event is with all of the participants making an action plan and a commitment for the next year. So one of the next things that's going to happen is our goal of using this model is to, as we've done here, we created an assessment process where people are looking at the current state with respect to the different elements defined by this model and setting a desired state. What would they like to increase or improve over the next year? Now, to do that, as you move into concrete action, there will be various kinds of tools and resources necessary, kinds of trainings, various kinds of support. And one of the things we've been working with is how do we create interdisciplinary, biodiversity in the support teams. So I think some of the next stages of this, there are two parts of the next stage. One is we're taking this same research process. We've already started an international survey, but we're going to be repeating this same kind of survey in France, in Greece, in some other countries. So we'll be also getting what are the commonalities of success in different healthcare systems, as well as what are some of the nuances, what are some of the differences that need to be taken into account. But the second part, of course, is putting it into practice. So one of the next things we want to be doing is really supporting this model with what are the concrete procedures, tools, technologies that are going to support really bringing this change into healthcare systems.